I wasn't particularly surprised that Dr. Reginald Sharpe is still licensed after what he did to Chloe and what nearly happened to several of his other patients, but I sure was disgusted. This is Christina with the Sisyphean Journal, and today is January 19th. So Dr. Reginald Sharpe already had a history of malpractice when a 26-year-old patient named Chloe went to his clinic on January 11th of 2008. Now, Chloe is referred to as patient 1 in medical board documents. And if you follow the link below to Chloe's story on Blogspot, you will find a link to the medical board documents in question. So Chloe went to the clinic, which was owned by Sharpe Family Planning in Detroit. Sharpe performed an ultrasound, determined that Chloe was about 15 weeks pregnant, administered some drugs, and started the abortion. But shortly after he started it, Chloe began to have seizures and develop trouble breathing. Now, credit where credit is due, Sharpe did call 911 promptly, unlike so many other abortion providers that I've covered in this channel. However, like so many others, he didn't provide proper resuscitative care. Now, fortunately, because he did call the ambulance, the medics were able to get her breathing again. They rushed her off to the hospital, but really the damage had already been done, and Chloe died on January 19th. Now, Sharpe told the medical board that he knew he'd perforated Chloe's uterus. He didn't realize that he'd also torn holes in her intestines, a uterine blood vessel, and her liver. So I guess it's not all that surprising that Chloe died. Now let's look at some other patients who almost ended up where Chloe ended up. So patient 2 wound up having to be hospitalized in 2011. She was transferred to a hospital where they found a fetal head poking through a hole in her uterus. Sharpe had done so much damage to her uterus that she had to have a hysterectomy. Another patient was undergoing a 2-day procedure in 2014. Sharpe perforated her uterus and sent her to the hospital. He had pushed fetal parts through the hole in her uterus into her abdominal cavity. Okay, patient 5. She went to Sharpe for an abortion December 31st of 2014, and she later sued. Her name was Bianca. She was about 16 weeks pregnant. Sharpe did not get her cervix adequately dilated before he started the abortion. He spent about an hour trying to get the fetus out. Bianca was crying and screaming in pain. She said 2 nurses were holding her legs in the air while she was begging him to stop. He finally did set her aside for how long? About an hour and a half. She asked for more pain medication. He tried again to complete the abortion and just couldn't do it, so he sent her to the hospital. Other surgeons had to repair her mangled uterus, and she lost about 2/3 of her bladder, which he had managed to chew up with instruments. And Bianca required multiple follow-up treatments for the damage to her urinary tract system. So there was another patient that he was disciplined by the board over. This was supposed to be a 23-week abortion, but he was having trouble. So he gave up, sent Rachel to the recovery room, saying that he'd try again later, and left the facility with nobody with adequate medical training there to supervise her. Rachel went into labor. She screamed so loudly in pain that her mother heard her clear out in the waiting room and demanded to be taken back to her daughter. And it was Rachel's mother who assisted her in delivering the dead baby on a cot in the recovery room. Now, Rachel's mother called an ambulance. She got hold of Sharpe, and he was demanding that nobody touch his patient. And the medics were so afraid of having a confrontation with him that they loaded Rachel up in the ambulance before they even started to assess her, and drove away so that they wouldn't have to deal with him. And it turns out that she was not 23 weeks pregnant, as he had said. She was 27 weeks pregnant. Guy's still practicing. Hey, no problems here, right? Safe and legal.